Hi, everybody. You are listening to the Medea podcast series. Medea Medical Education Academy is a global medical education provider dedicated to designing, delivering, and evaluating medical education programs worldwide. Today we will be speaking with Serap Sivri, Professor of Paediatrics in the Division of Metabolism in the Department of Paediatrics and Chief Physician of the İhsan Doğramacı Children's Hospital at Hacettepe University, Ankara, Turkey. At the end of the podcast, learners should be able to outline best practice for newborn screening for PKU. This podcast is part of the continuing medical education program entitled PKU Blended Learning Journey 2025, targeting specialists in pediatric and adult inherited metabolic disorders, dietitians, nutritionists, clinical biochemists and geneticists, basic scientists, psychologists, gynaecologists and obstetricians, nurses and all healthcare professionals helping those with PKU. All materials will be suitable for all geographic regions.
Hello everyone, welcome. I am glad you are all here. My name is Dr. Serap Sivri. I am a metabolic pediatrician from Ankara, Turkey. I've been working in the metabolic fields for over 30 years. And today I'd like to share the story of newborn screening in Turkey with you. My center is Hacettepe University Children's Hospital, and it is one of the oldest and well-established metabolic centers in the country. The number of PKU cases we are carrying is about 3,000, so we have a wealth of experience with this disease. You know, phenylketonuria, as I am going to tell as PKU afterwards, is the most frequent inherited metabolic disorders in Turkey. It's because due to the high rate of consanguineous marriages and relatively high carrier frequency in our population. Also, Turkey has one of the highest reported incidence of PKU in the world. This means we see far more babies with PKU here than in many other countries. So today I am going to talk a little bit about newborn screening story for PKU and the other diseases in Turkey.
Can you describe the issues you are facing in Turkey that impact your national screening program for PKU, please?
So to understand the screening processes in Turkey today, it is important to go back to the history of newborn screening. The idea of screening newborns for PKU dates back to a pivotal moment in 1983. That year, Professor Dr. İmran Özalp, she's also founded our metabolism department in my hospital, conducted a pilot study among children with intellectual disabilities. She discovered that around 5% of those children had undiagnosed PKU. A startling finding that immediately raised the question, how many babies out there might have PKU without anyone knowing? This was the spark that ignited the first discussion about nationwide screening program in Turkey. With this revolution, the first PKU screening efforts began in Ankara at Hacettepe University and soon expanded by nearby provinces. Early data from those pilot programs showed that approximately 1 in every 4,500 slave births in Turkey had PKU. To put that in perspective, that's incredibly high number, one that made it clear we need to screen every newborn to catch the disorders in time. These early efforts were led by Professor Özalp and her team at that time. The process was not yet well organized. There was no comprehensive registration system for samples, and unfortunately that means some newborns were missed in the beginning, but over time more hospitals and regions joined the cause. and the screening program spread from Ankara to other major cities like Istanbul, Izmir, Sivas, and beyond. So by that point, PKU screening was available everywhere in Turkey, and it was no longer just a pilot project by a routine part of newborn care. So as the program grew, it also began to expand beyond PKU. By the end of 2006, newborn screening for PKU was officially integrated into our national healthcare system by adding congenital hypothyroidism into screening program as well. In other words, it became a true national program organized, standardized, and operated under the Ministry of Health across the country. So over the years, more disorders were included, such as biotinidase deficiency was added into screening program in 2008, cystic fibrosis in 2015, congenital adrenal hyperplasia in 2017, and most recently, spinal muscular atrophy in 2022. So today, with just a few drops of blood from a baby's heel, we can screen for 6 conditions at once. These comprehensive approaches ensures that thousands of babies get a healthy start, protected from multiple hidden disorders that we can now detect early.
How did newborn screening start and evolve in Turkey?
Let's look at what the program looks like today, what challenges we still face, and what we are doing to improve it. We'll also consider why our experience here could be a source of inspiration for other countries around the world. Today, newborn screening is a well-established routine in Turkey. It's offered to almost every newborn, usually when the baby is between 24 and 48 hours old. The procedure is quick and simple. As you all know, a few drops of blood are collected from the baby's heel onto a special Gotcha card. This tiny sample can then be tested for those 6 conditions, including PKU. Importantly, the screening is completely free of charge for families. It's covered by our national healthcare system, so cost is not a barrier for parents. The reach of the program is truly impressive. For example, in 2023 alone, around 1 million babies were screened in Turkey. Thanks to this early testing, over 5,000 babies that year were promptly diagnosed and treated before they even showed any symptoms of their disease. Each one of those babies had the course of their life change for better. Instead of facing severe health problems or developmental delays, they were able to start treatment on time, and it's truly life-changing, not only for the child, but also for their families. So coordination of screening is managed through 2 main centers, one in Ankara, in capital, my city, and one in Istanbul, which oversee the processing of all those blood samples and the reporting of results. When a baby's test come back positive for a condition, there are protocols in place to quickly notify the family and get the baby into treatment and follow-up care right away. So in short, the program today is widespread, efficient, and it operates as a cornerstone of preventive pediatric healthcare in Turkey. So, as I told you, we've made huge progress over the decades, but of course, there are still some real challenges in the system.
In your opinion, what is needed to remedy these challenges?
As we know, no system is completely perfect. One past challenge was early hospital discharge, which used to make timely blood collection difficult. But things have improved. Family physician can now take samples, and home visits are being piloted in some areas in Turkey. Awareness is another area we continue to strengthen. A small number of families still refuse the test, often because of misinformation or because the baby seems healthy. In some cases, this happens because misinformation spreads on social media or in the communities. For example, unfounded rumors that the test might harm their baby or it isn't necessary. And parents might think, well, my baby looks healthy. Why do we need to test if nothing seems wrong? It is exactly what makes newborn screening so critical. You cannot tell from the outside if a baby has PKU or another condition at birth. The babies do look healthy even if they have a serious hidden conditions because symptoms haven't appeared yet. So we also work hard to make sure that even the most remote areas are covered. Turkey is a large country with diverse regions. So some places are far from the specialized centers and some of them may have limited healthcare sources. But that's a gap we are working hard to close. So proudly, I could say that today newborn screening is available in every corner of Turkey and all babies have the same chance at early diagnosis of care. So to address these issues and further strengthen the system, honestly, it starts, in my opinion, with education and, of course, awareness. Parents should learn about the test before the baby is born, ideally maybe during the prenatal visits or through public health campaigns. Healthcare workers need regular training and refreshers. This helps maintain high standards and awareness, especially in busy maternity wards. And also, I believe better technology and tracking system can also make a big difference. We've embraced technology in Turkey. Digital alerts and monitoring tools are now being used to make sure no baby is missed. Turkey has now achieved full digitalization in newborn screening, and digital tracking is available, and every baby is registered in the national health system. So families also can check their baby screening results through the eNabız, which is the common portal for Turkish healthcare system. So positive results are automatically shared with healthcare providers, so follow-up can start immediately. Newborn screening is a team effort and Turkey has a strong, dedicated team. Even though our screening program works well overall, it is important to recognize what can happen when any part of the system doesn't function as it should. So if baby isn't screened, or if the results doesn't reach the family in time, he might miss the chance to start treatment early. Take PKU, for example. Without early diagnosis and treatment, this condition can cause serious health problems. But when we catch it early, as we do in almost every case today, we can prevent all those serious complications. Babies grow up healthy, they can go to school, and they live full lives and healthy lives. That's why every step in the screening processes matters so much. The few times when something does go wrong are reminders of how important our work is, and then they push us to improve even more. So, as I mentioned, with digital tracking systems, ongoing education, and strong communication between families and providers, we can make sure that every baby gets the right start, no matter where they are born. So, Turkey's newborn screening program has come a long way, and we are very proud of the process so far. But also know that the work isn't over yet. In fact, there are several important efforts underway to make the program even better. One major initiative is a built and expanded newborn screening panel, meaning we aim to increase the number of conditions we can detect from the little heel prick blood sample. We currently have 6 disorders on the panel, but there are plans and ongoing research to safely add more treatable conditions in the future so that we can help even more babies before they ever get sick with the expanded newborn screening. Each new condition added to the panel goes through careful evaluation, weighing the benefits of early detection against the readiness in our health system to handle the follow-up and treatment. It's an exciting area of development because advances in science are constantly giving us new tools to detect disease earlier and intervene sooner. Another important area for Turkey is premarital carrier testing. This is also a preventive strategy where couples, before they marry or decide to have children, are tested to see if they carry genes for certain hereditary diseases. In Turkey, we already have premarital screening programs for some conditions, for example, thalassemia in certain regions of the country. And now there is a growing effort to strengthen and expand the programs to include some metabolic or immunologic conditions. The idea is simple. If we can identify carrier couples early, we can offer them genetic counseling to inform them about potential risks for their future children. This doesn't replace newborn screening, of course. We will always need to test babies at birth, but it does add another layer of prevention and awareness in the community. So, strengthening premarital carrier testing could significantly reduce the number of unexpected diagnoses by making sure parents are aware of their children, their carrier status ahead of time. So, we believe that with the dedication of our scientific and medical teams and the support of our health administrators or policymakers, Turkey's newborn screening program will continue to grow and improve in the coming years. They are continuously fine-tuning the system, educating the public, and responding to challenges as they arise. It's a collaborative effort that has brought us this far already, and that's what will continue to drive our success.
What take-home messages do we have at the end of this podcast?
So I want to leave on a hopeful note, not just for Turkey, but for other countries as well. Our experience shows that even when a country has a high incidence of conditions, like it's happened in Turkey for PKU, it is possible to turn that around through a well-organized screening program and dedicated teamwork. We've gone from a time when many children with PKU were undiagnosed and suffered lifelong consequences to now diagnosis virtually all cases at birth and giving those children a chance at a normal life. There are still some countries in the world, I believe, that have not yet implemented newborn screening programs or are just beginning to consider them. I hope that Turkey's journey can serve as both an inspiration and a practical example for those places. Starting a national newborn screening program can feel daunting, but the benefits are enormous and very tangible. Every baby, no matter where they are born, deserves the chance to get a healthy start in life. So, by sharing our story, I hope it sparks more conversation, more improvements, and more action toward that goal in other parts of the world. So, it has been a great pleasure to share Turkey's newborn screening story with you, and I am optimistic about what the future holds, both for our program and for newborn screening efforts worldwide. And I believe every small step we take can lead to big differences in their lives of children and their families. So thank you very much for listening to me.
Thank you for listening to this Medea podcast. For more information about our continuing medical education programs, please visit our website at medeaacademy.com.